United Nations Global Compact presents Listen Up, a podcast about making better choices for a sustainable future. So, why don't you just grab a seat and
listen up.
Listen up.
Listen up.
Listen up.
Hey, listen up.
Greetings from the United Nations Global Compact in New York. I'm Dan Thomas, and you're listening to Listen Up, a podcast series on the young and not so young business leaders driving change in their companies in order to create a more sustainable world. Who says profit and purpose can't go hand in hand? Today, I'll be talking to Rolof Mulder, the founder and CEO of Hospitainer, a Dutch company offering modular health infrastructure solutions to even the most far-flung communities, the aim being to minimize human suffering. I've heard a lot about you and your company, Rolof. It's really nice to finally get this chance to talk to you. Where in the world are you right now? Where would you rather be?
I'm right now in the Netherlands, in my home. I think I would rather be in Africa because I just came back from Kenya where we had a great project and we just had a meeting with Africa and I'd love to go back.
So thanks so much for joining us for this conversation. First of all, why don't you just tell us a bit about Hospitainer, the origin of the company, how you got it started. Where does it all start?
Yeah, Hospitainer started about 11 years ago. What we do is actually mobile medical solutions for disaster areas, for conflict areas, and also for rural areas. It's starting more now. And, well, how it started... Actually, when I was a kid, I wanted to be of help, let's say, to people who don't have what we have. I think in the West we have so many blessings when it comes to health, to other services. And I remember when I grew up, my mother used to read me from the Bible and about John the Baptist. And he said, if you have two pairs of clothes, just share one with somebody who doesn't have nothing, who does have nothing. So that was very natural for me, that idea. And also raised as a Christian, seeing Jesus Christ going around healing people, restoring the relationship with the Creator. That gave me a lot of inspiration to do what I wanted to do as a kid. And for that reason, I thought I might become a doctor. And I became a nurse. But in that time, I had a burnout and learned a lot about myself. But I changed also my profession to computer programmer, part-time musician, TV program maker, even a pastor of a small church. And after a while, I started my own ICT company, especially for impact. And when I was in Africa, putting there a container with satellite connection next to a hospital in the middle of nowhere, I had to wait for 6 days, and waiting is good because you have time to think. So I thought, why not build, because there was a hospital for about $15 million and in the middle of nowhere, and it was kind of over the top. So I thought, why not build for this price maybe 50 to 100 hospitals that are much more robust. So I had time to think about it and pray about it. When I came home, I talked to my wife and said, okay, I would like to build a hospital. And that was quite a move for us because, it would change our future. So again, we prayed. We said, okay, let's do it. We put in a mention of our pension, and I started to build the first container hospital in the garden of my neighbor. And after 1 year, the hospital was finished. The money was also finished. So it was quite a tricky time for us. And but then after a short while. MSF, Doctors Without Borders, they came, they said, because their hospital collapsed in Haiti after the earthquake in 2010. So they asked me, is your hospital still available? And I said, yes, of course. And so we packed it, sent it there, and built it up in 3 days. And that's actually the start, how it started. So a bumpy road, but with a lot of dots, as Steve Jobs said, if you connect the dots, you see a line if you look back into your past. But this is, how it happened.
So I just want to unpack a little bit of that and just go back to some of the things that you mentioned there. But first of all, what gave you the idea to put a hospital in a shipping container?
Yeah, I already was putting the ICT units in a shipping container, and a shipping container is really practical to transport, strong. If there's no facility, let's say in a rural area or disaster area, it's really quick there. It's very high, a lot of high hygiene, when you have an operation theater, for instance. So it's much quicker than building by stone. And transport, like I said, is also really a very positive point because you can transport it all over the world by ship, by train, by aircraft, etc.
And is everything contained within the shipping container? How does that work?
Yes, everything is contained, like water, energy, medical equipment. When we send it including medicine, even the clothes for the doctors and the nurses. Like we have a 50-bed hospital, which is a combination of containers and 3 big trucks. And then everything for 2,000 surgeries is already included in the hospital. So roughly for a year, if it goes to an area where there's nothing. Even the kitchen, the water systems, energy, it has to be complete when you send it somewhere.
So what experience did you have building hospitals?
The experience in building hospitals, when I started, was actually none. I worked for 6 years in a hospital. That gave me the idea of hygiene, infection prevention, and so on, and practicality. But building itself, I didn't have any experience. So I started with the grinder and the drill and just started.
And just tell us about the cost of doing it. So you had to borrow money from your own and your wife's pension in order to get the business off the ground. I mean, how much were the initial costs to buy the container and then start refurbishing it into a hospital that you could eventually send to an earthquake zone to save lives?
Yeah, we had about 100,000 euro. So that's all that we invested in the first hospital. It was a combination of 4 containers and a lobby in between, including the equipment and furniture and so on.
How has the business grown in terms of profitability? I mean, can this kind of sustainable business be profitable as well?
Our company is profitable. Of course, we have good years and we have less years. But in general, we are growing. We have now about 4,000 square meters in our factory. We have many clients within the UN, with governments, with NGOs. Also, defense is also buying our products because they also use it for peace operations and other operations. So once you have a good solution, I think you will find other people also find there's interest from the market. And we want to have it profitable because impact for us is number one. Making profit is number one because with profit, you can create impact. If you don't have profit, you always have to go back to, let's say, donors, which I don't think is a wrong thing. But my choice was to start a company. And by doing so, being more independent.
Have you seen a lot of competition? Have other people copied your concept and come into the market?
We have seen competition. For example, we call it our Hospitainer, a unit that we designed especially for women to give birth, but also for treatment of sexual violence, according to WHO, UNICEF, and UNFPA. We have delivered this product many times, and now we see it copied. But after that, it was like bought from the Chinese. They came back to us because I think the quality we put in is higher than some other companies because we do it from our perspective of making impact. That women are really helped there, and that we put in extra material that was maybe not on the bill of quantities because we believe it's important to add it. So. And also going to, let's say, disaster areas or war zones, it's not something that competitors like to do because it's risky. So that gives us an advantage to competitors because we do that the whole thing, we put in the medicine for, let's say, 1 year. And altogether, we see that's a unique selling point. It's the drive, it's the motivation, it's the going the last mile, etc.
You say that the first deployment of the Hospitainer was in Haiti after the very big earthquake that they had there. Tell us a bit about that. How was it transported? How quickly was it able to become operational and to start saving lives?
Yeah, for the Haiti earthquake, when the call came in, the contract was made in 1 day, 1.5 days, and we packed it in 2 days. The shipping by ship took 2 weeks. And we put it together. We flew in the meantime there and put it together in 3 days. And then about 2,000 surgeries were done.
That's extraordinary. It's written on your website that you're committed to making the Global Compact and its 10 principles part of the strategy, the culture, and the day-to-day operations of the company, and to engaging in collaborative projects which advance the broader development goals of the United Nations, particularly the Sustainable Development Goals. How do you go about this in the business?
When I started, I did kind of call it market research or whatever, and we saw that 300,000 women die every year around giving birth. This was a research by UNFPA. And also learned that about 2 billion people don't have access to basic surgery. So I took this data from the UN and said, okay, this will be my goal, to contribute to the health of women. I think 50% of what we do in Hospitainer is especially for women and sexual reproduction, also help for sexual violence. And this way, in general, when it also comes to water, energy, solar energy, we try to incorporate all these principles, these goals, into our units, into the service that we provide.
How about the way you measure your impact as a business? I mean, are you able to sort of measure the outcomes of the business in a wider societal sense?
Yeah, we try to measure, let's say, the number of surgeries that are done and medical treatments. And I think up till now, we are at about 125,000 surgeries in our units and 1.3 million medical treatments. Impact is hard to measure if you really want to have numbers. But we see that in the numbers that we reach, the people that we reach, that it must have impact in their lives, in their societies.
Where else do you operate?
Yeah, we operate mostly in disaster areas and conflict areas. Like, for instance, in the Middle East, in the war in Syria. We started there. And since then, there are about 13 projects in Syria, from mobile clinics to static clinics. But also, for instance, after the typhoon in the Philippines, the earthquake in Haiti, I already mentioned. There are many refugee camps where we also supply medical care to. So it's quite a wide variety. And since, let's say, a couple of years, we are focusing more on the rural areas where there's no healthcare or no good healthcare. And people say it's not possible there because there's no financial basis to do it. And therefore, we kind of designed the Healthy Villages program that we say, okay, we are going to go to these areas with healthcare, but also with production of food. And healthy food will help patients to heal quicker. It will create income. And with this income, we can also pay for the people that don't have access, who cannot pay for the healthcare. So this model we are now going to test in Kenya. We did already a pilot in Colombia. And this is, I think, our big next goal. We want to nurture the community as a whole because we believe that health is not only your physical health, but it's also education, it is agriculture, it's peace, negotiations, reconciliation, which we also were involved in Syria. So the well-being of a person is much more than only his body. And also the ability, for instance, to work or to start a small business, or for women to be healthy and to contribute. Especially women contribute a lot to society. So we also want to empower them. Once we got a call from UNFPA to if we could do something for the Yazidi women that were captured in Mosul as sex slaves. And Mosul was going to be liberated, and they said, we need your units for the women when they come out to be treated. And it took 3 months for the paperwork to be finished, and finally we sent those 15 trucks, but actually it was too late. So this frustration gave me the idea to buy a truck. We bought a Paris-Dakar service truck of the rally, the tough rally. And we said, okay, once there's a demand from somewhere, we will go there ourselves. So we're preparing that right now because we have the units on stock. So like, for instance, in Afghanistan, when the refugees had to leave, we were ready to start directly, but unfortunately we couldn't get there because of the restrictions of the Taliban. We were not allowed to go there. But the idea is that once you are frustrated and you turn it into an action, something new will develop that will, I think, bear fruit.
For young people starting out in their studies or careers, what would be your best advice about the opportunities to be found in the area of a purpose-driven business?
If you look to the worst person, let's say the worst version of yourself, if you write that down, maybe you should practically do it. I heard that advice from somebody else. And you can look at it and say, is this the person I want to become? And then if you write down, for instance, if there were no limitations at all, what would be the person I would like to become? And what would I like to do? If you write it down, and if you look to those two pieces, you can make a choice, to focus on the bottom one or on the top one. And then make a plan, write down a plan for yourself. How am I going to be this person that I really want to be? And what is my purpose that I believe in? And which steps am I going to take to get there? And am I prepared to fall and to stand up again, and to fall and to stand up again? And I think this will help you to have focus, to dream big, but also to make it very practical.
What part of that journey, that early learning, the trying of different careers, you worked in as a nurse, you worked in television production, you worked in music a little bit, you mentioned, you traveled the world a little bit. I guess all of that contributed to a moment in time when you felt, okay, I can make a real difference to the world.
Yeah, when I look back, let's say, to my journey of different jobs and things that come into your life, right now I see, when looking back, that all the dots, like Steve Jobs said, if you look to the dots, you see a line. You might not see it right at the beginning, and you might wonder, I thought also I have made a mistake choosing nursing, for instance, but now I see how important it is for me. And also the creative part that I developed in myself, I can use to create new solutions. And one thing as a young professional, you can learn skills, but you also have to learn character. And character is maybe more important than skills, because character is harder to build than skills. And let's say a crisis is not a waste, even if you don't understand why you're in a crisis.
This is great advice. Thank you so much, Rolof. Where will you go next? What's the next project that you have in mind for the world?
Well, the next projects for the next 10 years I have in mind is to bring healthcare to communities in a holistic way with food. We work together with an organization that starts with greeneries, with healthy food for kids, for families, and also to make money for farmers, to train farmers, and to combine it with healthcare, but also with education, reconciliation in war areas, water, energy, solar energy. So to bring all these things to communities so that these communities can thrive and be sustainable. That's the goal for the next 10 years.
How do you think the climate crisis will affect your business?
We see that the climate change has an impact on the world, on disasters, climate-related disasters. And when there are earthquakes, floods, hurricanes, etc., I think our work will increase. Also, we try now to say to governments or organizations, be prepared. So we can help you to be prepared, for instance, by having solutions on stock. That once something happens, we can deliver in 24 hours, or we have it in the area where it will happen. So we're having these discussions now, for instance, with our government when it comes to the Caribbean islands, that we can prepare to be there for a hurricane or in the hurricane season.
Thank you. These are great answers. Thank you so much, Rolof. We have a rapid fire round of questions, so please answer these questions in 60 seconds or less. What's your most embarrassing, most unsustainable secret, your guilty pleasure?
Well, eating too much potato chips in the evening when I watch television.
Well, there's nothing particularly unsustainable about that, is there? Have you ever hugged a tree?
Yeah, actually, 2 days ago, I was with my grandchildren, and we were building a hut around a tree, and then my grandson said, "Oh, this is a soft tree," so we hugged the tree.
What's the most surprising thing you've learned on your sustainability journey?
The most surprising thing I learned on my sustainability journey is that women are actually giving the most value to society. So if you empower women in their strength, I think that contributes most to society, next to solar panels and the heat pump that we have and driving electric, etc. It's people actually that are the most important when it comes to sustainability.
You've been listening to Listen Up, a podcast series from the United Nations Global Compact on the business professionals who are driving sustainability in their companies in order to create a more just, equitable, and sustainable world. I'm Dan Thomas, and I would love to hear from you, our listeners. So please let me know what you think by writing to me at thomas@unglobalcompact.org and tell me who I should talk to next. Goodbye.
You've listened to the United Nations Global Compact podcast. Now it's up to you. Be bold and take action. And don't forget, listen up.